These are exciting times on the back of the African Union Summit that just ended. I think it's a good time to talk about the future of healthcare in Africa. Uh, Before we talk about the future, I think it's also important to consider what it is at the moment. We have healthcare in Africa today that is bedeviled with poor access to care at the time of need. Lots of places in Africa you pay out of pocket, especially in the sub-Saharan Africa, out of pocket payment to access care, and that really puts a limitation to the number of persons that can access healthcare per time. The quality of care cannot be comparable with what is obtainable in most of the developed world, Western world. There is healthcare inequity. The penetration of healthcare technology is very poor. I mean, a glaring case is West Africa as a whole having one functional PET imaging center, located in Lagos, um, serving the entire West African sub-region, and that is also even a private facility, not even in a public hospital. So that tells you the limitations that we have in healthcare, technology penetration in Africa. Manpower skill sets are also low. Uh, Significant brain drain has also taken away lots of our brilliant medical personnel, whether you're talking about doctors, nurses, radiographers, laboratory scientists, and the likes. So this is the present. When we're looking forward, actually, to what it will be 10 years from now, 5 years from now, what's the future of healthcare in Africa? Now, the future of healthcare in Africa can only be brighter if we begin to embrace some form of regional integration, regional collaboration in the way we approach the matters that are affecting the quality of our healthcare. It will only improve as we adopt more technologies. It will only improve as we prioritize spending, by government and regional government, prioritize healthcare expenditure in our budget. It doesn't have to be when you live in a particular part of the world or part of the country that you are able to access care, or when you come from a certain rich background that you are able to access care. These inequalities needs to be bridged, and doing so has to be intentional. If we do these few things and much more, we are going to then begin to look at a brighter future for healthcare in Africa. Uh, I want to just mention maybe two or three scenario plays that we're expecting as far as healthcare in Africa is for today. Healthcare is coming onto the front burner in discussions around some government circles, in both in policy formulations and the likes. The African Union, for instance, has an agenda 2063 that is prioritizing healthcare development as a way of driving economic growth in the continent, and that should actually be applauded. So we see a future, if these commitments are met, we see a future of healthcare in Africa that national governments and regional governments are going to be increasing investments in healthcare, more development of infrastructure, more development in the deployment of technology and the likes. That's the future we're expecting. We're expecting a future also where there will be more funding coming into the healthcare industry in Africa. The African Development Bank has set a priority to spend about $4.4 billion between 2020 to 2025 in health, into the healthcare industry in Africa. We see the Afrexim Bank building the AMCE, the African Medical Center of Excellence, the first of its kind here in Abuja, Nigeria. And this hospital is going to, open up, the second half of 2025. And that's going to change, a lot of scenario play as far as healthcare in the sub-region is concerned, especially in the Western African sub-region, because it's a major investment that is going to be transformational and catalytic in nature to change the healthcare landscape in the region. So we're going to be expecting, healthcare in Africa that will continue to improve, healthcare in Africa that will continue to guarantee access to its population. We're going to have more digital technology being deployed. We're expecting a healthcare in Africa that is going to be adopting more of artificial intelligence, in our healthcare technologies, both to have better diagnostic capabilities and also to be able to harness more data about our healthcare indices. Uh, AI is going to play prominent roles in the healthcare industry in Africa going forward. It's already doing so, and there is market research showing that it will continue to grow, as much as 25% annually from 2025, um, which is very good. So when you have more of the artificial intelligence penetration, diagnostic capabilities will be improved. Um, Digital technology devices will also be enhanced in the abilities that we have in those devices. All right, so this is just the initial, assessment that I thought I should, present today. I'll come back to you in just, a short time from now as we look at, as we continue to look at the future of healthcare in Africa. But I can tell you the future is exciting, the future is good. Healthcare in Africa is gaining momentum, it's gaining, some form of recognition. Investment is coming into the sector, partners are collaborating, and therefore we can only expect improvement year on year. Thank you. Have a great day and stay blessed. Thank you.